So it's one of those topics that you'll be speaking through your whole medical education, and in fact, after you graduate as well, it'll become even more important. And it focuses on talking about the health of the population and how the health of the population, therefore the health of the person, and how it can be improved and different things that you can use to improve it. So things like screening tests, like I'm sure a lot of you would have heard about like a bowel screening test that is nationwide. That's something that population health has been trying to gather data on and show that is effective because it helps prevent really, really bad diseases. In the later years, it will also give you the ability to look into research papers, and these research papers are things which might be look very, very long and look use very confusing terms, and that's why we need to kind of build our skills over time. And once we build our skills over time, we can look at that information and say, okay, I can synthesize from that information that this thing is important, and you can about it with your patients as well. Okay, so like I said, the most important part of population health, which is carried across from undergrad years, or sorry, from preclinical years into clinical years, is being able to talk about these statistics and data. So we'll talk about a couple different definitions of data, uh, and talk about how that kind of applies to it. So the first thing is true positives and true negatives. So true positives are people who have the disease who tested positive. So that means that yes, they have the disease and they were diagnosed by the disease by some other method and they've tested positive on the test. True negatives are the people who don't have the disease but tested negative, and why we want a true negative is because we want to make sure the people who don't have the disease aren't being said to them, oh, yeah, you actually do have the disease. But that's just going to give people a fright and make people really anxious and nervous about it. So we want to make sure we have a high percentage of true positives and a high percentage of true negatives. And that's where the concept of specificity versus sensitivity comes in. And it's really easy to mix up the two things and think, okay, I'm just going to pretend that they're the same thing and kind of mix the two up. But it's important that you know the difference. So, sensitivity, how I think of it is how sensitive a person is how easily they can pick up people in their region. So if you imagine a very sensitive person, I just imagine that they have like a radar on their head and they're able to pick up a really large radius of people because they can detect them really easily. So how we determine what sensitivity is we divide the number of true positive people with the total people with the disease. And that will give you the percentage of people with the disease who were found to be positive, which gives you the ability to kind of say, okay, so if I have a 70% sensitivity, that means that 30% of my people are being missed, right? That 30% of the people with the disease are actually being missed. And we can kind of extrapolate from that and say, that's not very good, and we need to develop a better test. Specificity is like the opposite but twin of it. It's essentially talking about the ability to exclude people without the disease. Because, like I talked about before, if you told somebody without a disease that you have the disease and then later on went, just joking, not actually, they would be very annoyed and have a really big shock. So, we try not to do that by trying to increase the specificity. So, if we talk about true negatives over total without disease, what you're actually getting in as the bit which is left over is false negatives, right? And that's a even bigger no-no because we're thinking, oh, so we have true negatives who don't have disease, so we're happy with that. But then what about the people who actually have disease and that we said are negative? So that kind of runs into complications again. Okay. So the last two measures that we're going to talk about for pop health are positive predictive value and negative predictive value. So the positive predictive value is that the chance of an outcome that is given is going to be have to be a positive result, right? So with a positive, so it's essentially the chance of somebody with a positive result actually having the disease. So remember the other one when we're talking about sensitivity, that was the total amount of positive people saying that the total amount which had the disease, right? Compared to this is the total positive over the amount of the people with the disease and positive, so true positives, over the total amount of positives, whilst the other one was over um, the total amount of disease in the population. And it works the same way for negative predictive value. So essentially what we're looking for is the chance of the diseases not happening given a negative result. And in fact, the negative predictive value is probably more important than even the positive predictive value. Because if we do a test on somebody and say, okay, so we've gotten the test results, they say they're negative, but how do we know whether it is negative or not if we don't know what the negative predictive value is? Because if you don't know what the negative predictive value is, you will never be able to tell whether a result is reliable or not. Cool. Alright. Let's so if we want this all together, what we want to do is kind of seesaw this because as we increase specificity, the sensitivity will decrease, right? Because we're getting a higher amount of true positives in the test, and the other one is trying to increase the amount of true negatives in the test, right? So if both of those exist here, and we need to figure out a system to kind of balance out those two together. And there's not really a structured system on how we say, okay, this is going to work, but we just try and aim for at least 90-ish% for each of those, and we get to a balance eventually, which we can say, okay, that's fine. Um, I'm happy with that result of that test, and when I use the other test as well, it gives me the same result, so I'm happy about that. Right? So it's kind of just a balance between different